haere mai, and welcome to Cult Chat, the podcast where we talk about coercion, control, and all things cultish. I'm Dr. Caroline Ansley. I'm a medical doctor. As a child, I lived at the Centerpoint community, a notorious cult in New Zealand, and now I run a website that advocates for the former children of the community.
I'm Liz Gregory, and I run the Gloriavale Leavers Support Trust, and I'm privileged to walk alongside people after leaving this group as they embark on their new lives.
And I'm Lindy Jenkinson. I'm a former member of the Exclusive Brethren, and I'm part of the Olive Leaf Network, a new initiative in Aotearoa to support leavers of high-demand religious groups.
Come with us as we unpack the cult playbook. We'll be talking to experts and leavers of coercively controlling groups, and we will call for Kiwis to cult-proof their lives.
Come with us as we traverse the cultiverse.
A warning, this podcast contains references to subjects and discussions which may be difficult for some people to hear. Please take care of yourselves and your whānau when listening.
Hi, Kaz here with my friend Anka Richter, who's the author of the fantastic book, Cult Trip. She's bringing us an exciting event this year.
Thanks, Kaz. Australasia, get ready for Dcult 2024, the first cult awareness conference in New Zealand, happening in Christchurch this October. Are you worried about a friend or family member who's in a group that may be causing them harm, or do you have your own story? Then join us for a weekend with experts from around the world, where those who've left cultic groups can share their experiences and meet professionals who can help them. Head to our website, dcult.net, for all the info.
Come cult-proof your life at Dcult 2024. I'll be there. Kia ora koutou. We're back with the girls in the studio again in Plains FM, and we're having a wee yarn today. How are you guys going?
Oh, we're good. We're busy. There's always things to do in the cultosphere.
Yeah, what have you been up to, Liz?
Well, I've been trying desperately to find time just for the odd read of a book, actually. It's a bit of a struggle. Sometimes you need to prioritise self-care and downtime. Yes, so I've been reading a book called Gretel's Courage, and it's just about the war and the time of Hitler and the Jews, and of course there's often sort of parallels with just power dynamics, coercion, control. But this one young woman, she did this range of acts of rebellion, and she ended up working in the office of some of the bigwigs in the war, and she deliberately put the files in the filing cabinet in the wrong place. And it was just her little way of contributing to the war effort. But she did a lot more than that.
Good book then.
Yes, but I probably should just read mindless novels, but anyway.
Always trying to grow your brain, aren't you, Liz? Good one. What about you, Lindy?
Oh yeah, I haven't been reading lately, but that does remind me of a story is it Sophie Scholl, the White Rose, incredible story. I love it when they're people who would otherwise be seen as quite powerless, young, female, often not particularly educated or things like that, and yet they're able to do these amazing acts of resistance, eh? It's really cool. Yeah, no, I'm not too sure what I've been up to. I'm trying to think what's happening in the garden. That's always a good sort of self-care question, because for me, a big part of self-care is getting out into the garden. So yeah, love that. I'm very much an amateur. I'm sort of, I just throw things in the garden and see if they grow, and I don't give them any particular great love or attention, or necessarily pay attention to the seasons or that sort of thing. But I'm a bit, if I just see a plant on sale or something, I'll just grab it and poke it in and see if it works, or stumble across someone with some seeds, poke them in and give it a crack. But I don't really do my research about whether it should be buried 1 inch or, on the surface. But I kind of like that because it adds to the risk of, is this actually going to work? Makes it more of a gamble rather than a guaranteed outcome. And it's quite fun, a couple of months later, there's some beautiful flowers. Oh, that one did work. Yeah, so...
Are you like a floral? Is it floral?
Oh, nah, try and grow eating things as well. But,
nice.
Yeah, not hugely dedicated, just sort of hurl things in there and see if they pop up.
Oh, yeah. Wow. We'll continue to watch and wait to see if you produce anything good.
Yeah.
I'm wondering whether Kaz does the gardening thing. She's got all these animals that might dig around and...
Oh, yeah. Well, I don't know. The garden is not my domain. It's my husband's domain. I leave it entirely to him. What I have been doing is I have been going on other people's podcasts.
Oh.
It's a little experiment in advertising and marketing of a Cult Chat, actually.
You mean you've been taking interviews?
I've been the interviewee.
You've been the interviewee. Fantastic.
Yeah.
What's that experience like?
Oh, it's quite nice having someone ask you questions and be interested in you. I have to admit that. Yeah. But there was some definite concern at the beginning that I'd sound like a total dick without you two. But I've been reassured that that's not the case. So
No, you're very wise actually, Kaz. Is that why you've got doctor at the start of your name?
yeah, well, you can get that without being wise.
Can
I
you?
have to say, yes.
disappointing.
You just have to go to med school and get through.
But you can't get on this podcast without a little bit of wisdom, surely.
Yeah, but you guys don't have doctor in front of your name.
No, we don't.
Yeah.
No.
Yeah.
And
I'd
that's
like
why
to
we
have-
say we're not experts. We're just sitting around having a chat about cults.
Yeah.
Well, if I had letters in front of my name, it'd be something like CL. CL dot Lindy Jenkinson. That stands for cleaner.
choir leader.
Yeah, or DG, dog groomer.
Yeah.
Or
Well,
M.
I'd quite like to be.
Mum.
One of my favourite books is Catch-22, and there's a character in Catch-22 called Major, and
Nice.
the story is that his last name Major. The story is that the dad didn't talk to Mum and named his son Major because he thought it'd be funny. So he just first name, second name, last name Major. And of course, when he got in the army, he immediately got promoted
to being major.
to Major. So he's Major.
Oh, no.
So
Stop it.
I'm not sure if I could do Doctor.
Yeah,
Doctor.
but yeah, we could. I mean, you do have actually a fancy title. You're like Doctor.
I could get a
Clinical-
PhD and then be a doctor.
Okay.
Yeah, that'd be fun.
And then have a
Doctor,
professor as well, maybe.
clinical
eventually.
major sergeant editor.
Yeah.
Something.
I think there's a point to this discussion.
No, there
Parents,
isn't.
be really careful what you name your children. They have to live with that for the rest of their lives.
Well, yes, that does.
Name change.
It's a good segue into cult chat today.
Yeah. So anyway, today we're going to be talking about why therapists need to upskill on the topic of cults. One of the most common things I've been told by cult survivors is how they struggle to find a therapist who understands their particular context. They've had to spend the first 5 or 6 sessions maybe explaining to their therapist the cult experience that they had, educating them about the dynamics of the cult.
And having to pay for it.
Yes, that the therapist wasn't even interested or was way too interested in their cult experience. So yesterday, Liz and Lindy spent a day running a workshop for therapists and pastoral care workers and some of their support people. I wasn't there, but I'm dying to find out how the day went. Okay, team, tell me about it.
Oh, it was an amazing day, and thank you to Mind Health for organising it. Lindy flew all the way from Wellington just for that, and now we have the advantage of her in the studio. So, Kaz, it was a day that went from 9 till 3, and we had myself, Lindy, and Faithful Disciple, a former Gloriavale member. Basically, we all sat up on the stage, and the day just bounced around. It did have a structure. There were sessions. We looked at just laying the foundation of cults, cult understandings, cultic language. Then we looked at the impacts, because unless you can understand the impacts, something that the way the cult has impacted the person right from birth perhaps through into adulthood, the therapy you offer, it might not be the most appropriate. And so then we really looked at the best way that therapists and social support workers can get around people who've cults. It's the what. And then we just, at any point, any of the panellists were able to say, oh, I've got an example of that. And so you just had these real life raw stories coming, mainly from Lindy and Faithful. I admitted to being an imposter. I'm neither a former cult member, nor a counsellor, nor a social worker, nor a pastor. And yet I have listened for 10 years to people who have come out of Gloriavale. And so I do have some understanding about the what.
Absolutely, yeah. And Faithful left only about 3 years ago, along with his wife and 8 children, and so he's still in a very raw place of finding his feet. And yeah, I think the question is, why was a day like this needed? Why did Mind Health value this? They are a group of therapists, and they it had started out as them wanting in-house training, and then there was such interest in it from other therapists or people supporting former members of high demand groups that they said, hey, can we open this up to more people? And so there was a good room full of people there, and some people on Zoom, and the answer to that is that people who are former members or current members of high demand religious groups have got unique challenges and a unique landscape that they're living in. And just as we have therapists who specialise in something like domestic abuse or addictions or eating difficulties, or there's so many things, as we know, that present unique symptoms and present unique challenges and come from a unique environment. And we are strong advocates to say that if you have been recruited into and left, or born and raised in and left a high demand, a highly controlling social environment, then you are going to have unique impacts that therapists need to know about so that they can better support you. And actually, one example of this, I had a lovely man come up to me yesterday. Shouldn't probably say this on air, but I hope I'm right in saying I think he was in his 50s, and the reason why I'm saying that is because he had left a high demand group in his 20s. So this is somebody reflecting back on several decades, and they described how at various points in their life they had turned up in therapist offices presenting with certain things on the surface, alcohol addiction, problematic sexual behaviour, depression, just life being out of control, all this sort of thing. And he talked about how, therapists were usually, focusing on the immediate thing at hand or wanting to dive back into childhood stuff. And he said it took me so long to realise that my profound trauma and a complicated trauma was in my 20s, when I got completely cut off from my whole social environment and my biological family, and that it was then that the alcohol and sex and depression and chaos making stuff began to happen. It was all as the impact after that, and nobody recognised it until several decades later. So that's just an example of what we're why we're so passionate about educating therapists in particular, that this and around the world there is an increasing awareness that religious trauma, or trauma from this particular kind of religious social impact, does have its own unique impact. So it's wonderful to be part of that wave of awareness.
Yeah, the effects are quite debilitating, and it's for the therapist to understand just the unique dynamics of a cultic environment. And we drew heavily on a couple of books. Cracking the Cult Code for Therapists, Bonnie Zeman, just can't express to you how profoundly important this book is for people to read. The other one, Escaping Utopia, Janja Lalich, growing up in a cult, getting out and starting over. A lot of research has gone into this, and really there's a real focus on what is it that therapists would need to understand. And one of the great quotes out of Bonnie's book, it says not all ex-cultists even are aware that they've been in a cult or want to use that word necessarily, and that's not what's important. But it's the understanding that the client has been unethically influenced, dominated, controlled, exploited, and at a minimum psychologically abused. So it's understanding the devastating impact of those factors on a person's development.
And it's pretty hard for a person to come with all that baggage to see a therapist and have it almost register no response from the therapist or a dismissal. They mention it if they've got the insight to appreciate that it's a significant aspect of their story, and then it just to have it drops on the floor between the therapist and the client and is not picked up again.
And the therapist may pick up on something else, thinking that's the issue. Oh, it's an issue of something that happened in your childhood, not recognising that it could be. Do you remember Faithful talking about how cults create empty shells of people? There's that destruction of the internal world, and then they stuff it full of their own indoctrination and dogma. And then,
he talked about how you can look on the outside like a grown adult man who's might be able to hold down a job and be dressed sensibly and that sort of thing, but how he said that on the inside you're just like a broken, whimpering 2-year-old child, who's just come through this incredibly traumatic experience of you having your whole world disrupted and torn apart, dealing with major grief and loss. He talked about the loss of his cousins and his mother and family members, and how he still, he just cried just talking about them. He said, I just miss them. So, you're dealing with so many things, and we won't be able to go into all the impacts today, but in a future series, we'll pick through some of those impacts. Or even if you listen to our earlier episodes, we're constantly talking about the impacts. But, what we're trying to say is there are unique impacts. There's often trauma associated with leaving, traumas associated with the time in the group to work through, and then there's trauma and very real difficulties and challenges of building your life going forward,
building your identity,
building your identity going forward, at the same time as often coping with major grief and loss of losing your whole social environment. What an incredibly disruptive and damaging experience that is. So
and also a relationship to time as well. I think someone who's come out like faithful, 2 or 3 years ago, is in an acute grief, stress response period versus someone 10 years later,
that's right,
who may or may not have processed some of it.
Yes, and we talked about that, and I like to use the earthquake analogy because there's very much a crisis period of acute shock when a person won't turn up in a therapist's office in the acute shock period because they're like literally just trying to survive from day to day, trying to wrap their head around, what to have for dinner, and that sort of thing, or where they're going to put their kids in school, or, trying to even start to begin maybe holding down a job or getting dressed in the morning. And so that could be a period of a few weeks and up to a few months or the first year. And then there's, like a more medium term finding your feet, sort of settling period, and that's often when people will maybe begin therapy. And
only if normally their life spirals downward to a point where they feel like
they can't cope.
Because the first response is not to go to a counsellor or to go to someone who they've never met before.
People are normally very desperate when they start looking for a therapist.
There's something different here. We've talked about this repeatedly, about the inside-outside dynamic that goes on in a cult, and the idea that is always in these groups that they have superior knowledge and understanding and values and ideologies, and that we shouldn't, that people in the outside world are less or inferior. So there's this stigma that is built into people in high control groups about people in the outside world, and definitely people in authority. Definitely. So doctors and therapists definitely are treated with some suspicion or disdain.
Yeah, and
particular groups like Scientology, Gloriavale certainly, and some others are not coming to mind, but definitely Scientology, definitely do not go to see therapists.
No. And it's not, of course, actually, the odd thing is they sell it as we have more superior knowledge, but it's not about that. It's about a control mechanism that they don't want outside influences coming in and infecting and diluting their worldview or their ideology.
Yes, and it's very effective. Yeah, it's a major obstacle, this thing of why would I trust a therapist because they belong to the evil, outside, unenlightened world, and we have the greatest enlightenment, so what on earth would I gain from a therapist?
Yeah, I read a quote in that book, Escaping Utopia by Janja Lalich, where she talks about double stigma.
Oh, yes.
The double stigma. So the person in the group who's come out of the group actually sees the therapist or the doctor or any helping professional as less than, so they have the stigma towards that, towards the helping profession, and then the helping profession currently, and we're trying to change this, sees the leaver in a stigmatised way.
Right, like you're a victim or you're...
No, that they weren't clever, that they got sucked into the group.
They chose it.
That's right.
Yeah.
And don't forget there's an extra layer here that inside some of these sort of faith-based groups, to admit you even have problems or mental health challenges means that you didn't have enough faith. And so it casts doubt on your salvation and whether you're truly in
and just because you've left the group doesn't mean you've changed your worldview.
No. You walk out with your indoctrination and your dogmas, and then this empty shell of a person begins to throw some of those off and then has to find a way to replace them with a coherent worldview, and there's a lot of muddle in that period.
So in short, what we're saying to therapists listening is that if a client steps into your doors and they are a former member of a group like this, there has been a huge amount of work and a huge step of trust and risk on their part to even step into your office. And so to, do your mahi to honour that and to receive them, and, you know, do a bit of background homework as well to help you to be able to receive them well is really important. And yeah, we'd love to spend a bit more time today talking about some of the things that you can do to be that safe person. I still keep remembering back to the time of the conference with Dr. Bessel van der Kolk in Christchurch, which was an incredible conference primarily aimed at upskilling therapists around trauma. And one of the things he said that just stuck with me was, you know, what's one of the first things we can do to help a person recovering from trauma? And he said, firstly, it is by establishing safe relationships. And of course, I believe that therapists are a beautiful component of what that looks like. For a traumatised person to begin establishing safe relationships, it's very clear that a therapist cannot be the only person to help because, hey, it took a village to destroy this person and it's going to take a village to put them back together again. But a therapist can be a very powerful key component of the person's healing. And yeah, we've got a few tips and things for therapists around what you can do. Do either of you want to start with some of your tips, or shall I launch with one?
You're telling me about it.
I've got one that just, it really strikes me. It's the differential. The power differential between the therapist and what you might call a client. We've had this discussion before with Talk Clever, not even using those words. It has to be, there has to be a greater levelling. So even though counsellors and therapists are taught to reduce the power dynamic, actually it needs to be significantly reduced even further with the cultic group, because there's just this hypervigilance, a hypersensitivity that they have around even just going to therapy. So there's this question out there, would you go for a walk?
Yeah.
Would you go along the beach?
I suggested that yesterday. I was like,
would you walk around the block?
Why don't more therapists go for a walk on the beach with their clients instead of sitting in a stuffy office? Come on, let's bring around a revolution. Counsellors, get out of your offices.
Meeting in a private corner of a cafe that the person will feel comfortable with, rather than, because often if you've got a group, like someone coming out of a place like Gloriavale, to go into a meeting with someone, that like sends shivers down your spine, because the only meetings you ever got asked to go to was when the servants and shepherds, you were under discipline, there was a grilling going on. And so even ministers who say to people who've come out of cults, I'd love to come around and see you, can I pop in and visit at your home? Oh, I know, they have like panic attacks over that. And so there needs to be a lighter way of making that connection and just thinking outside of the box. Perhaps you're going, are you comfortable with me going to your home? They might have barriers that make it difficult for them to even get in to see you. And it might not look like the classic conversation, but perhaps that's not what the ex-cultist needs. Perhaps they just need a place of safety and they know that someone's listening. For them, that could be their first step.
So I'm thinking automatically, how do you as a therapist identify? Because you're describing a person who's said, I've come out of cult and I need to find a therapist. And that's a person clearly articulating their high control group experience, which sets the therapist up to start to think down how can I help this person?
Yeah, some people won't lead with that. You're right.
They might balk against it. In fact, it's probably not a good idea for the therapist straight up. If it hasn't come from, the former member, I wouldn't be saying, were you involved in a cult? You're going to have to identify that it sounds like there have been a lot of control, there's been a controlling environment. You're going to have to identify by what they say that their identity development, that there's been a lack of personal identity. You'll know that because when you ask them questions about what would you like to do or what are your interests and hobbies, there might be quite a blank look, well, I don't have any. The therapist is going to have to dive into this understanding of this unique area.
So we're talking about some red flags, some things that might give away the information to say that the person has been in a high control group.
That's right. And it's easy because you when people tell you things, you can say, that sounds like you've been under undue influence, or it sounds like there might be some coercion there. So you can actually start to use language to help school the person who's come out of a group. And over time, the word cult might come up. It's not the word cult that matters, it's the concept.
Yeah, it reminds me of yesterday, Faithful Disciple talked about how a fish doesn't know it's wet. And that's so true, that often, I mean, I imagine it would be the same with somebody who's from a home of domestic violence, or a home that had, domestic or intimate partner coercive control. If it's your normal, you don't know that anything is different. And so, you might not even have language for it. Oh, this is just how things were. This is how mum and dad behaved. This is the level of control that leaders of this group had in our lives. It was normal. And so, they may not lead with talking about this stuff, or may not even be able to name it. And so, for the therapist to be able to be educated about those kinds of things, and to gently lead questions and awareness raising, and some of that's pointing the client to further resources to educate themselves, knowing that you don't have all the answers and all the experiences, but that there's just an incredible plethora of books and resources out there that can really, really help the person.
And people. You talked about when people come to you and ask, I'm leaving a group and I'm needing support, you encourage them to have three people?
At least set up, if you're, especially probably in the planning to leave stage, but it is really vital afterwards as well, to have, that whole Bessel van der Kolk thing of you need safe relationships. And so what can you be doing to make sure you've got other safe people? And, one of those, you usually encourage people, make sure you're talking to your medical doctor so that you can be considering things like, your physical health and well-being, that they know what's going on with you, so that if a crisis period hits, they know your history of extreme pressure that you've been under or whatever. So medical doctors, important to be talking to, and I encourage people to set up a relationship with a therapist before they even leave, if possible. We might have to do it deceitfully, but setting up a relationship with someone you trust before you leave to help you through that crisis period can be amazing. And then one other safe person, nearly everyone's got one other person. It might be a neighbour who you just sense as a trustworthy person, or a business colleague, or many people go back and draw in their school teachers because they know that their school teacher was a caring person. So that can be 3, and then going forward you need those people as well.
Do you know how difficult that is inside a really closed self-sealing really unit like Gloria Vale? Like even access to the medical doctor or the counsellor or this other outside safe person. Who is that person? There are no external school teachers for those children. It's very difficult.
And the whole doctor thing, I have to say, we're still growing awareness in that space. It's what we're talking about, what we just said before about understanding that the person you're treating may have come out of a high control group. That's unfortunately even harder for a doctor because they've only got 15 minutes. It may take years for the person to volunteer this. However, we're in the business of finding out what things are impactful in a person's life to lead to negative health outcomes. So I think this is growing, and we're working on this and hoping that Cult Chat will be part of the education for doctors as well as
that's amazing.
therapists.
I've got a couple of other practical tips that I think are really helpful with therapists. I mean, I'm pretty sure therapists are trained in this stuff anyway, but being aware of your physical location and your body and your postures and your responses, because people from former members of high demand groups are often very hypersensitive and attuned to, especially a person who they perceive as an authority over them, which, I mean, you do perceive that when you're paying a therapist who's an important person with their own office and letters before their name and a university degree when you probably don't have one, all that kind of thing. So they can be very hypersensitive to any you can feel that you immediately walk in there and you just assume that you have no voice in this space. And so a therapist will need to regularly, again and again, not just once off, because it's not a cognitive thing for the client. They need to really feel safe to name their wants and needs in that space. And so for a therapist to regularly check in and say, I'd like to remind you that if I start taking this conversation in a direction that you're not comfortable with, you are welcome to say, actually, I don't want to talk about that today. Or I don't, what I'd really like to talk about is this. So every time, invite the person, remind them that they're in the driver's seat here, because they need to be given that power, or they will feel too bad.
And it can be how you say it even.
Yeah.
You can say to them, oh, look, if we're having this conversation in a direction that doesn't suit, just let me know. That might be too flippant. It might be, I would really love you to help direct this conversation, and if you feel I'm going the wrong way, would you let me know?
Yeah.
See the two different ways that it was spoken? Same message, different delivery. Yeah. One is just much softer.
The other thing I wanted to talk about is because EMDR is increasing in popularity, and many people have found it really, really useful, and Faithful Disciple. EMDR, a type of therapy. You can Google it.
We talked about it on Dcult.
I know what it is.
Go back to the trauma conference podcast.
No, our listeners may not know.
I know you're asking for the listeners. Yeah, so EMDR, you people can Google it. It's a type of therapy.
Eye movement,
eye movement,
desensitization, something.
But the point, what I want to talk about EMDR is some people find it really helpful. Faithful Disciple said he'd found it really helpful.
Life-changing.
I personally didn't find it helpful. At the Bessel van der Kolk conference, he talked about how it had proved useful for adults who have experienced trauma, but who had previously had quite a safe attachment, but it hasn't, according to their research, proved very useful for people with complex PTSD or developmental trauma. Anyway, the reason why I wanted to talk about that is because one of the things that I found confronting with EMDR was that it means the therapist has to come very close to you, because they have to they normally sit right in front of you, which is actually in itself, confrontational. They don't sit next to you to do it. They have to sit
and
in front of you.
Contact. Ooh.
Yeah, and then they put their fingers in front of your eyes and go back and forward like that. I actually found that really confronting, because one of my worst memories in the Brethren is of being in a small room with two men so close to me that their knees were almost touching me as they grilled me in quite a violating way about things that had happened to me. And so for me to have a therapist, a person in a position of power, come and sit very close to me like that, it just took me straight back to that place. And I had to talk myself through it and be like, this is not the same. But yeah, just a reminder to therapists that being in a close physical proximity with someone in power could be very confronting. And so to talk that through with your client and check in with them about that if you're going to be doing EMDR. Yeah. Any other tips off the top of your head?
Off the top of my head?
More, but
I was also thinking about, and Liz, you've said to me this is relevant for Gloriavale leavers, is the lack of understanding of the health, and it also applies to therapy, the rules of engagement in the therapeutic or health sphere. We don't appreciate how much we learn when we're out in this world about how to engage with the health system or the therapy system.
Yes.
We get these bits and pieces all the time in conversation, when we tag along with our mum to the doctor.
That you can advocate for yourself.
Yeah, or
for example,
or just how you interact with a health professional. Like a doctor I know told me that in his communication with cult leavers, he found that some of the rules were broken. Like the patient kept on ringing him up out of hours, and you're like, that's an absolute no. We all know that. You don't ring up your doctor out of hours and just sort of ring up for a chat, But why would you know that?
That's right. They don't know.
Why would you know that?
To them, here's a safe person who was listening to me.
Yeah.
They're my friend now. They're my safe person.
Exactly, my safe person. But there's actually rules of engagement, professional boundaries that are unspoken, that no one gives you a handout to say this is how you interact with a therapist, this is how you interact with a doctor.
That's so true. It reminds me of a story I once heard, slightly different context, but I once heard about, because growing up, Brethren were not allowed to go to restaurants or cafes at all. And I remember hearing a story about a Brethren woman who'd left, and then she ate at a restaurant, and then she she cleared the table up and gathered the plates up and took them out to the kitchen, because that's what a good Brethren woman would do.
Exactly.
But people were just like,
Exactly.
WTF.
These social rules and all these different environments that they may not have learned.
Yeah.
So if you, as a therapist or a doctor, don't respond well, you can shame a person.
Yes.
And shame is something that they've had too much of, a whole lifetime's worth of shame in this group that they've been in. So being able to kind of communicate some of the what might feel like obvious rules,
boundaries
of engagement, and say them up front, and just remind, this is what we do. We meet for 50 minutes once a week. You need to tell me if you're not going to come.
Yes.
It's really important you tell me if you're not going to come.
Because I have other clients that may want this space, and I have prioritised you.
Yeah.
And you not coming and not giving any notice means that this part of my day, is left empty, and this is my work, this is my job.
Yeah, exactly.
And I've prioritised. It's a way of respecting someone.
And they don't know this stuff because they haven't learned. And in fact, not only have they not learned, they've learned other really unhelpful ways of interacting with people that they have to unlearn and now learn some more respectful, boundaried ways. So as a therapist, setting out the rules of engagement and making sure they understand them and not doing it in a shaming way would be really helpful for ongoing trust.
And that's some of the work we're looking at doing, creating a healthy transitions resource for Gloriavale leavers. But it's not just about their mental health and wellbeing, and it's about some of the really practical things like that, like doctors, how to engage with them, and even weddings. And we've written a sheet on funerals because people who've left a group like that may never have attended an outside funeral, and we were fielding a lot of phone calls. What do I wear? How early do you turn up? Where do you sit? And so we're actually writing and documenting some of this and circulating it around Gloriavale leavers.
It's social norms.
But it's like every part of your life. It's part of our culture. And this is what we spoke about yesterday. Cults have their own cultures. And so for someone who's left a high demand group to come out into our world, it's an entirely new, shocking cultural experience. And there's nothing for them to really recognise, except we kind of look the same. It's like us going, let's pick a country. I'm going to go to Nepal, and I've got nothing but a small backpack, and I'm going by myself, and I'm going to land myself in the middle of Nepal. And I don't speak the language, and I don't know anybody, and I don't know I don't know where to start. I'm going to feel like an alien. And this is the feeling of someone who's actually left a group. They feel completely and utterly like an alien, and it's only time. I will always feel like an outsider in Nepal, though. I think we need to state that. I'll never not feel, I'll always know.
But you will know,
I'm an outsider.
and Nepali people will know that you're an outsider, and they will appreciate it, and they won't judge you for it.
Because we look different.
Yeah.
Whereas someone coming out of a high demand group in New Zealand, they look and sound like we do, and yet there's all these cultural norms that have not shaped them. And they feel alienated, and they'll often go through their whole life feeling they don't quite fit in. And I think that's true. And
then the group loves to say, that's because you still belong to us.
Belong to us. Yeah, that's right. Back. And so don't be afraid of that feeling of even 20 years later, I don't quite fit in. That's okay. I wouldn't feel ever like I fitted in the Nepali culture if I moved there either. There's nothing to be ashamed of.
Yeah. So back to more tips.
Yeah, I've got a couple more tips, and then I'd love us to talk about something which is, a bit controversial, but what about when clients have had a really negative therapeutic experience already? So we'll come back to that. I've just got one last tip. Often people who have connected to groups, not always, that have been controlling, not always, but often this faith or spirituality has been woven in, has been weaponised against them, whether it's self-help or New Age or Christianity or whatever. It doesn't matter what the beliefs are, but often a person's spirituality or beliefs have been weaponised against them. And sometimes clients may want to maybe in a space where they're like, throw it all out, I don't want any of it, I don't want to talk about it. But inevitably at some point, reassessing, deconstructing and reconstructing what spirituality looks like for them will be part of the process. And it's a really important thing for therapists to bring up as well, to make space for that. It doesn't need you to be an expert in that person's spiritual beliefs to make space for that. But yeah, a couple of times I've had therapists just say things like, just name that and welcome that for me. They didn't share my beliefs, and they, told me that. But for them to say, how does your faith impact you when you think about this decision? Or, has there been any aspect of your spirituality that has guided you here? And I really appreciated them inviting that, because before that I thought, I can't talk about that there, because with the culty kind of mentality, it's so black and white. One of the things you're not given tools for is how to interact with people who've got different beliefs from you. You're only given tools to talk with, trust, interact with people who think, believe, talk, walk just like you with complete uniformity. And so it's a real skill, and something that's quite nerve-wracking for a former member, is to learn how to talk with someone, anybody, a neighbour, a business colleague, but a therapist who believes or thinks differently to you. And so for you as a therapist to model safe dialogue and openness, willingness to hear from me with my beliefs, that's, you're giving me a really powerful model to then, to feel safe to talk about those things.
And it will feel quite dangerous, just because what you're talking about to me is exploring the grey of faith. When you've had a history of black and white, you're in heaven, you're not in heaven.
Yeah, you've got to believe this or you can't.
Yeah. And like, if you've strayed, well, you're more than strayed. By leaving the group, you've been ejected from that belief system, but you've got something left. There's something there. And many people, to have to completely throw it out because there's no safe way to dialogue about what now is very, very grey.
It doesn't really help either. Sometimes you need to throw it out just for a time, but inevitably, So for a therapist, people's spirituality and beliefs and faith, whatever language you want to call it, lots and lots of people have that part to themselves and want to be able to explore it. And so for a therapist, for a therapist to make room for dialogue about that, because our behaviours come from our beliefs so often. And so making space, how have you, exploring those things, how's your morals and values changed?
And I think with what you mentioned earlier about the idea of your faith being, you said, if you're not getting better, it's because you don't have enough faith. If you've got a mental health problem, or if you've even got a physical illness, it's because
it's been weaponised.
Yeah, it's been weaponised against you, and everything becomes spiritual. Yes. You don't get to just have asthma. It's a spiritual thing.
Hunger, greedy, tired, lazy.
Yes, exactly. Everything's spiritualised. So that's Gloriavale, but I think it's also fair to say that it occurs in other groups as well, that the spiritual domain takes over everything. And again, if there's no space for it in therapy, you won't understand the motivations of the person. You won't understand what's in their thinking about their illness or their mental distress, or whether they're allowed to express it or not, because the spiritual is very likely to be completely interwoven.
Entirely. And then if you've got a therapist who goes the other way and uses too much Christianese, Christian lingo inside their therapy sessions, you are at huge risk of triggering your former member, because lots of verses and ideas and concepts which are so well meaning and intention and are wonderful and healthy have been abused in those groups, and they take on a different meaning.
It's true, not just for Christianese, but I think any spiritual, again, if spirituality anywhere has been used, words like gratitude, for example, it can be really positive to keep a gratitude journal, and yet if you're in a group, as we heard, I have heard people connected with Sri Chinmoy, that actually the concept of gratitude was, again, weaponised against people. You should never complain. You should just be grateful. So, for a therapist, again, to invite the client to share, please let me know if I inadvertently use a word or a phrase that is actually associated with some abuse for you. Please let me know. You educate me, because there's no way as a therapist you can know all of the words. I
think that's a key idea, this mutual education and growing. And this is quite different from probably what occurs with other clients. That as a therapist you might feel on pretty safe ground in other kind of presentations. But this, I think, recognising you're learning and sharing it with your client, I don't know, that might feel professionally risky to say, you know what, you're the first client I've had who has been in a high control group or has volunteered it to me.
Yes.
So
You know, like,
help
and
educate me.
help me. I'm committed to learning on this topic. I'm reading these books.
Yes.
I'm attending these webinars.
I'm listening to Cult Chat.
I'm listening to Cult Chat, and I'm growing. And you know, I think to me that would help
Yeah.
me.
Yes.
And you know, like, I certainly, as a doctor, when I volunteer make those kind of comments, I think my patients
open up,
appreciate it.
yeah.
But
Especially saying that you are doing some research. Otherwise, they feel like they're paying you.
Yeah, to educate
them.
There's
and
a fine line there, isn't there?
There is.
Hey, let's talk about when therapists have been abusive or are abusive. This is really important because it has happened and it does happen. And we've got a couple of examples we'd love to share with you. Do you want to tell us about what it's like?
Well, those who've been listening to Cult Chat know that I've got a history in the Centerpoint community, which was active in the mainly 1980s and 1990s, and it was a therapeutic community that grew out of the human potential movement. And people went to Centerpoint. The way they came across Centerpoint was usually through some kind of personal therapy that they might have had with a Centerpoint therapist who was operating on the outside, or because that they had been told by their doctor or someone while they were in hospital that here was this live-in community that did workshops, week-long workshops or weekend workshops where you could do some healing and you know. So people were...
Sounds fantastic.
Yeah, and I think many people actually will still say now, even with a history of abuse that happened to Centerpoint, that the weekend that they were there or the week that they were there changed their lives. So I've still heard many people say that.
Yeah.
But, you know, like, there was extraordinary abuse that happened there. You know, people, the therapists, for instance, would gather information from their clients, air quotes, and share it with the leader and use that information to then control them further.
Wow.
So it was in the work groups. I've never heard any child of Centerpoint talk about the work groups as being a positive experience for them.
So you're talking about therapy in a one-on-one context was sometimes abused, and you're talking about group therapy was also used in abusive ways.
Yes, very much so.
So how, for those people who have been abused in a therapeutic context, would they ever set foot again inside a therapy
Well,
office?
you'd think, we were talking about this yesterday, you said you thought that Centerpoint people would never go see a therapist. But I don't know about the adults. I think the adults were attracted to personal growth and change. So many of them probably...
Deeply motivated by it.
Yeah, probably that was the kind of people they were. It was all about personal growth and change. They may well have quite a different relationship with therapists now post-Centerpoint.
Right, they were able to differentiate between what was an unhealthy therapeutic context and
I don't know, I'm
what's
guessing. But the children of Centerpoint, right from the get-go, they were forced to have therapy.
Right, and it wasn't really their choice.
It wasn't their choice, and it certainly didn't help them. It actually just depressed them further. So to me, it is actually remarkable that any former children of Centerpoint see therapists, but I know many do because they see it as being a pathway to deconstructing their experiences and building safe, healthy relationships and learning how to be, better.
I see.
So, but they do so, the ones that I've spoken to, with some wariness, with some hypervigilance, because of that history. And because at the time, when Centerpoint was operating, before probably it was very clear that it was an abusive environment, Centerpoint's ethos and values were pervading the mental health sort of sphere in New Zealand.
It was like the new thing, right? There's this new
mode. So I would say I have uncertainty about how far Centerpoint's harmful therapy reach has gone. I have some uncertainty about that.
Did any of them get struck off after the big Centerpoint expose and exposure?
I actually don't know of anyone who did.
A doctor? Did any doctor
A doctor
get struck
did.
off?
Yes, a doctor did. Yes.
Only one.
Well, there was, yes. Yeah, only one. Yeah.
Another example of when therapy has gone bad, and this is just allegations. I mean, I think there is some evidence for it floating around, but I'm not 100% sure about that. But there've definitely been allegations come out in the former exclusive brethren community of, and this was in the UK, not in New Zealand, but of brethren who were current members being sent to directed by church leaders to go to a particular psychologist who was put forward as being, a trusted expert. And this person was a very, very expensive, top-notch, I think, psychologist in the London area. And people were, very strongly directed to go to this person. And there's been several people who have alleged that they had to sign like a disclosure form agreeing that their client information from sessions could be sent to Bruce Hales or to brethren leaders. And, being good little sheeple at that stage, sorry, no disrespect intended, but, they signed that because it was what they believed was in their best interests. But actually, that's an incredible breach of...
And they would have had no awareness of what's normal.
Of what was normal, exactly. Yeah. And what an incredible breach of integrity and of the professional-client relationship. Absolutely despicable that the psychologist has done this.
It was in the newspapers, wasn't it?
I believe it was. Yeah.
So that therapist was actually collaborating with the leaders of the system that was oppressing their patients.
That's right. And the fact is that these former members started to try and go through a complaints process, and this particular person unfortunately took their life. And so
the therapist took
their life, and so no resolution has been able to be had in that particular case. But this person was part of a group of therapists, and I wonder if others were involved. Anyway, it's just one example, a very sad, very awful example of that sometimes therapists can have mixed agendas. No doubt it was incredibly lucrative for this person to be in the, to have this wee community all to himself, getting people come his way. But
so you're just reminding me of a work, some education that we've actually got coming to New Zealand very soon. We are part of bringing Dr. Jilly Jenkinson to New Zealand, a UK psychotherapist, counsellor, and kind of cult expert, really, who has got this fascinating program, amazing program of building knowledge in therapists. So she trains therapists as well as seeing her own clients as well. She has this program for training therapists, and we're bringing her to New Zealand around the mid-October.
October 21 and 22, straight after the Dcult conference here in Christchurch. So you can go to the website, our website, Olive Leaf Network, and look under events, and you'll see their workshop, 2-day workshop for therapists. And that will be with Dr. Jilly Jenkinson. That will be, for therapists only, and it will be 2 days of, high-level upskilling around how to support former members of cult-like groups.
And the other thing that may happen, depending on the number of numbers, is that what Jilly also does is she does this 5-day intensive for people who have a lived experience of being in a cult who are also therapists. This is what we're knocking on this idea that if you've been in a cult, because we've talked about it before, we talked about it with Tora, that people who've been in cults are uniquely placed to actually provide therapy that is so intuitive and nuanced, but because of their history of being in a abusive group, they've got some stuff to work through themselves.
Or
they
can
can
also
be triggered.
Be triggering. So Dr. Jilly is offering a 5-day intensive workshop. It will be limited to 8 participants, and specifically for therapists who are also former members or people who have experienced a high control environment. So if that's you, please do, again, get in touch with us at Olive Leaf Network, because we're taking registrations of interest. And we're just so thrilled to be participating with Dcult and Gloriavale Leavers Trust to help bring Dr. Jilly here and to be organising those events. So definitely sign up for them and for Dcult as well. And you'll have a tool bag absolutely packed full of resources to help clients.
So we've only got a few minutes left in this episode. So it would be really good to hear some closing thoughts. Some takeaway messages.
Yeah, I think the takeaway messages would be that therapists, you have done your training and you adequately know how to respond to people with trauma. You do have the skills to work with ex-cultists. What you might not have is just the unique understandings of what it looks like, what someone sitting across from you may be presenting, what's actually going on inside. And there could be bigger issues around, identity development, developmental delay, the shell of a person concept stuffed full of the indoctrination, as well as the shock of someone if they've just exited the group. And so somewhere along the way, you need to find out where they are on the journey. You know, are they thinking of leaving? Have they just left recently? And even where they are in their mind, they may be physically out, but they might still be mentally in the group. And so there's
even 10 years later.
That's right. There's a role there for therapists to understand the what, and then you can apply the various therapeutic models to assist. But at the end of the day, you need to realise it's extremely complex. It's wider than just the one issue they may be presenting with. And so to develop the person and their confidence, their agency, their decision making, affirming them when they make a decision, celebrating the achievement that they've entered a competition and won or not won. Just little things that you think went on during their childhood, they didn't necessarily happen in their childhood.
Exactly.
Attachment.
Yeah. And I think it's all around, I loved, again, I'm going on about Dr. Bessel van der Kolk, but I loved how at the end of his, a key thing that he kept talking about was, in terms of recovery, was he had this wonderful line. He said, imagination is essential to recovery, that you have to help people to be able to imagine new possibilities. And I think that all that kind of thing is just such an incredible and powerful part of being a therapist. It's not all about circling round and round the muck and sifting through the pain in the past. It's also about finding ways to encourage your client to imagine, to dream, to hope, to believe for new possibilities for themselves beyond this box that they have been raised in. So that's what I'd love to leave the session with, is around that. How do you cultivate joy and pleasure, imagination, dreaming in your clients?
And that my take home would be to encourage people who've been maybe tried therapy before and they didn't get the response they needed, to say, we are right in the middle of growing something new in New Zealand. Upskilling therapists that to understand about cults, high demand groups, and that if you've tried therapy before and you've had no luck, keep trying. Maybe drop a note to Olive Leaf Network and find out the name of someone who's a therapist who's on this journey of learning, and give it another go.
And if you're a therapist who wants to know more, feel free to contact me as well, because we have curated a list of resources to help you to go away and do your homework and upskill. Very happy to share that.
Excellent. Well, I think really it's a journey of hope, and that's what we need to leave for our former members of cult groups. There is a journey of hope. There is hope at the end of this journey. And so therapists, there is hope in here. So please take this great opportunity that training's offering you and all the resources that are available. And if it's in your heart to enter the sphere, please do. We're calling more Kiwis to get educated in this particular area. So thanks for joining us again. Nice to see you, ladies. And join us again on Cult Chat, where we'll always be talking about something in the cultosphere. Perhaps you'd like to head to our social media platforms, share some of our posts, leave comments. We're so delighted when people leave comments and encourage us. And we'd just like to leave you with a message of hope. There is hope. So,
see you next time.
See you later.
Bye, everyone.
If anything in today's episode was difficult or upsetting for you and you would like to talk to somebody, we encourage our New Zealand listeners to free call or text 1737 for support from a trained counsellor. Or you might like to visit the resources section of the Olive Leaf Network website, where you can find a range of organisations and resources that might be able to support you. We would also like to remind you that the views and thoughts and opinions that have been expressed in this program are the speakers alone, and Cult Chat does not necessarily endorse or share them.